Okay, so I think we are live on Facebook. This is Dr. Bridget Williams from Green Harvest Health, and this is the Wellness Toolkit. I love doing this series because it takes the questions that I have about holistic practices and it allows me to ask questions, learn more, and I think the questions that I have, I think you might have as well. Of course, I have my own line of CBD products and I see patients for medical cannabis, but this is one tool in your journey towards wellness. And so it's great to learn about other tools that can get you to reclaiming your wellness. So today we have Sharon Dean from Embody Health and Wellness. How are you today, Sharon?
I am fine. Thank you so much for having me, Bridget. I really appreciate it.
Absolutely. So I'm excited because we're talking about the power of massage. And I think people think they know about massage, but I think there are layers to this and possibilities that people really haven't considered. Or if they've been away from it from a while, maybe this is an opportunity to come back. So first, tell me about Embody Health and Wellness.
Um, you know, when I first started to do this, my career was something totally different. I am an anthropologist by trade. I did a lot of traveling around the world. And I really wanted to start my own health and wellness business because I felt that I could help people more. My dad was my inspiration. He was a physician like you. And I went on a lot of house calls with him. And I noticed what he could do with the power of touch. Since he was an osteopath, I learned about the power of massage very early. So I started thinking about doing this, and I left my position at the Ohio Historical Society in 2015 or 2014, and then studied to be a massage therapist. And I had this vision for a wellness center, Embody Health and Wellness, that simply put, we try and aim to help people feel better than they thought possible. We offer massage, we offer aesthetics. We now have product, and your product is prominently featured. And these are all tools, as you say, in our wellness toolkit to help people feel better without resorting to medications that would only treat their symptoms. These are things that can actually go to the root of the problem and help them beat chronic pain.
Absolutely. And so obviously your inspiration was working with your dad. And you know, I love the story of women reinventing themselves. And you're definitely one of those women that I look to that also made that jump. And so you went from anthropology to having a wellness center. So how do you like your lifestyle compared to where it was before?
Well, I am a firm believer in practicing what you preach. So when I was working in the museum field and working in a museum, I had a lot of stress. You always have to sing for your dinner. You're always having to raise a lot of grant funds. So you sit a lot and you get a lot of chronic pain. When I became a massage therapist and started practicing my vision for what a wellness center could be, I realized that lowering that stress, using massage to help lower that stress, increased my productivity and also helped me be more creative in my endeavors to try and help people. So leaving that field and reinventing myself was not just an identity change, it was also a mood changer, a decrease in stress, a decrease in anxiety, and just overall improved my health. And my numbers also improved as well in terms of cholesterol, sugar, blood pressure, pulse rate, all of that.
Yeah, absolutely. So you said two things there, that part of that lifestyle change was number one, decreasing your stress, right? We often think about massage as the person, they're beating up their body, you know, what have you. But a lot of that beating up of your body is actually the stress itself, as well as you said, part of it was the fact that you were in this sitting job, right? And so, you know, as a culture, as we grow, we look to go from the manual labor to having the desk job. But sometimes that desk job is more detrimental and harmful to your health than sometimes the more physical jobs, right?
Exactly. So we are not designed, we are not built to sit all the time. We really do need to move around. And if you look at history and people that have had better diets and have moved around and had physical exercise, those people tend to do better and they tend to live longer than people that just are sedentary.
Yeah.
So one of the things I always talk about is that people don't understand that there is a history and a scientific method to massage. So when I work on a person, when I assess them, I'm always looking for a couple of things. I always look at pain in the low back, and also from typing, you also get, one of the signs of that is to look at what's called the thenar eminence between the thumb and the index finger. And if that thenar eminence right here, that fatty part, is tender to the touch, it usually means that pec minor or subscapularis, one of the muscles right here, is tight. And if you can relieve that tightness, this will feel better. And this is because when we sit at a computer, we have our arms up and we're holding it freestyle like this. Now with the legs, if you think about the piriformis or the glute muscles often get tight because of the way we sit. And you can often tell that pain by just squeezing your calf. If you have pain in that calf, it's usually coming from your glute muscles. So there's a real science behind massage that I think can really help people with chronic pain.
Yeah, and I don't know if people realize that. I think they go in and they're hoping that, they can loosen up their muscles, but you're doing something way beyond that.
We're putting some science behind it so that we can show people that instead of taking medications to relieve the symptoms of chronic pain, we can actually go for the root of it. Now, to your point, and the reason why we're here tonight, CBD helps me do that. How does it help me do that? It helps me do that when I put on some of that freeze cream, for example, on the top of the glute muscles. It probably takes about a minute or two to work, but when it does, it relieves that inflammation, it warms up the tissue so that I can work it and then relieve the muscle contractions that form on the muscle fibers and that actually cause the pain that refers down your leg. So the CBD helps me work those muscles a lot more deeply than if I didn't have it.
Absolutely. So kind of talking about that, keep in mind that Sharon has so much of our products and she utilizes it so much with her clients with massage that I wanted to learn from her how she was even doing this, right? So we have our pain freeze cream, which I don't know how well that can be seen, but that is our pain cream, 500 milligrams, very soothing, has camphor, natural terpenes in there that help with absorption, where we also have our body butter, which is 400 milligrams of CBD, much more nourishing for skin conditions. So when you're using massage, which one do you tend to use more?
I tend to use the freeze cream more because of the pain that people say that they have. And usually, especially in this time of the pandemic and times of COVID, people are working 12, 14 hours a day on their computer. Mm-hmm. So I use the freeze cream to help warm that tissue up. I love the body butter though, for people that tend to have dry skin or some kind of skin condition like an eczema or a psoriasis that requires a little bit more of a moisturizing, I guess. And I find the body butter to be very nourishing and moisturizing. With the freeze cream, I tend to use that simply to go right to the pain target.
Right. And I do find that both of them tend to work better if they're massaged in. That if you're just kind of like glossing them on and moving, you're not getting that great penetration that can help make it work that much better.
You need to make it penetrate. Absolutely.
Yeah, absolutely. So then with using CBD, we talked about helping with pain. We talked about relaxing the muscles, right? The inflammation, and also nourishing the skin, right? So there's a number of things there that going into using CBD as far as your massage therapy can be really beneficial to helping that patient, get to a better place.
Absolutely. And one of the things I did, because I knew you probably would ask me about the sort of the science of massage, sure. But if you go onto AMTA, the American Massage Therapy Association, and you look up 25 reasons to get a massage. Each one of the things that they point out on this printout is really helps with, also really works well with CBD. For example, relieving stress that I told you about, post-operative pain, if there's adhesions that are forming, reduces anxiety, it manages low back pain, fibromyalgia, exercise, it enhances exercise performance. It works really well on tension headaches as well as migraines. It helps you sleep better. All of the things that massage can do, CBD enhances that.
Absolutely. So they work together. So whether it's the actual creams or whether even you're using a tincture so that you're getting a more systemic effect, that sounds like it would be beneficial.
Absolutely.
So right now, what, I don't know if you can really kind of give an idea of the majority of your massage clients, what is their main issues or diagnosis?
So the population that sees me is usually a senior population, people that have had knee replacements, shoulder pain, people that have migraines. So people usually come to see me with some type of chronic condition that they're not getting any relief for. So when I talk to them about doing the techniques that I use, like trigger point or craniosacral therapy, if it's a really chronic pain, I'll say, do you mind if I just try, just a sample? And with your freeze cream, I always tell them no more than my index finger, no more than what fits on right there. And I put it right on the pain. People are amazed at how the inflammation is reduced rather quickly. And then I can work deeper to resolve the real issue underlying it, which could be, a trigger point. It could be an actual strained muscle. It could be a lot of different things. But if somebody's in real pain, you can't work deep until you give them some relief.
Right, absolutely. And that's kind of a great place to start. Yeah. So then during this time of COVID, and everyone's had a hard time, right? Some people might be apprehensive in coming into a center for massage. So what can you say about having a massage done during this time?
The main thing that I try and do to make people feel comfortable is to talk to them about the safety and health protocols. So as per the guidelines for the Ohio Department of Health and also from the CDC, we have different teams of therapists that come in different days. So we stagger not just the appointments so the people don't see each other. We'll stagger them by about 15 minutes or a half an hour. But we also try and work on different days so not everybody is exposed to potential COVID, the COVID virus at the same time. I also make sure to leave the 15 minutes and half an hour between appointments so that I can completely wipe down everything with something like a Lysol solution. And that includes all of the surfaces on the table, and I line the massage tables with a non-porous plastic material so that I can wipe it off easily. But all the surfaces like the desk or the table, the chair, everything in there gets wiped down. I also don't let people in without going to their car first to take their temperature and ask them questions about how they feel. As long as their temperature is below 100 or below 99, I should say, and they answer the questions that they haven't been around anybody that they know of that has had COVID, they are not experiencing any symptoms, then I let them in. And they also have to wear a face mask when they come in, use a little bit of hand sanitizer. When they get to the treatment room, when they're lying face up or supine, they keep their mask on. When they turn over and lie prone or on their stomach, then they can take the mask off. But I make sure that these are strict protocols that we follow all the time so that we can control who's in the environment and how we have contact with each other. For myself, I make sure that I wear clothing that I can change out of easily at the end of the day. I always wear a mask. Sometimes I'll wear gloves. I don't have any face shields, but I do have plastic aprons that I can wear as well.
Yeah. And so honestly, during a time with so much stress and so much anxiety, people should feel comfortable being able to come in for a treatment like this.
Yes, I was closed between March 16th and May 26th, and I didn't want to reopen until we had the proper PPE and also had strict protocols in place so that we wouldn't jeopardize our own health or the health of our patients.
Yeah, absolutely. Very good. Very good. And so one question is, what myth or misconception do you think there is out there about massage?
The one big one I would say is the science behind massage.
Yeah.
And if you don't understand that there's a science behind massage that now includes it as an integrative treatment plan, not alternative, but it's an integrative treatment program or treatment plan, then you start getting all sorts of misconceptions that follow from that. So it is not a place, this is not a place you would go in order to get just what they used to call a rub down, or they wouldn't go and just get a fluff massage. Ours is a place where you go, where we address specific conditions, specific pain issues that people are going through so that I can help relieve them. This is not a place where you necessarily go just to have what is called a pampering experience. That would be a spa. Ours is more medically based. Right. So I would say the biggest misconception is not understanding the history of massage or the science behind it.
Very good. And I think that is something that needs to be clear. There are definitely spas that are just about the experience, but you're really providing therapeutic medical massages to help people get better. And that is something distinctive. And when people are looking for some place to receive treatments, they need to know the difference, right?
Right. So it's not that I won't give a stress relieving massage for people that have anxiety, because that is a real issue as well and a real concern. So I'll do manual lymphatic drainage, which can be very, very relaxing, particularly on people that are undergoing cancer treatments, because that is a way for them to really reduce the inflammation. I use the CBD in conjunction with that. It reduces the inflammation, but it's also extremely relaxing. But I also do deep tissue as well. And the deep tissue is very therapeutic for people that are just coming out of post-surgery. So if they have adhesions that are forming, deep tissue helps prevent adhesions from forming. I also use the CBD in conjunction with that to kind of relax somebody so that I can work deeper. But in terms of what it is I do, it depends on the kind of condition that they have, but it can be deep tissue or it can be light craniosacral or manual lymphatic drainage.
Absolutely. No, I love that distinction. I think it's really important for people to know that. So I'm going to switch over to the slides so that we can learn a little bit more about where you are and the fact that I work with you. It's not just the CBD, but I actually do medical cannabis evaluations, life coaching at Embody in Hilliard. So let's switch over to that so we can take a look.
Sounds good.
All right. And, oh, great. I love these, right? So, of course, we're talking about the power of massage and CBD during this time of isolation. And you really did confirm that people can come in and feel safe and know that they can be COVID protected and still receive a massage and feel better during such a stressful time.
And people should know that there are some times where I will tell people that we should reschedule if they have any sore throat, any sniffles, or they've been exposed in a way that I don't feel safe. I will just kindly say to them, perhaps we should reschedule for another week from now and let me know how you feel. Because I think it's very important that we protect ourselves and the rest of the population that comes in.
Absolutely. Yeah. So to keep open and to keep yourself safe, you have to make those decisions and it's best for the client as well. So absolutely. Yes. So now, as I just mentioned, that Green Harvest Health has our main office in Pickerington, but we have our satellite office in Cleveland, as well as with Embody Health and Wellness in Hilliard.
Yay.
Yes, and I'm excited to be there. It's a great group, and I love your approach and the way that you look at wellness in general. And so you can see on the slide there how to contact us, how to find us. A lot of our information is on Green Harvest Health Facebook, as well as GHH CBD. And a lot of information is on Dr. Bridget Williams on Facebook as well. So look us up and contact us and make an appointment with us. We're happy to talk about CBD as well as medical cannabis cards. And then whenever we do the wellness toolkit, we do provide a discount. If you're on here today, if you use the code GREEN35, you can obtain medical cannabis, or I should say CBD products, hemp-based products, off of our website and get it at a 35% discount. We appreciate you stopping and sharing in our conversation. And this is Embody Health and Wellness. And so Sharon, it is in Hilliard. Do you want to say a little bit about the location so people can find it?
Yes. So if you come off of 270 to the Fishinger Road exit and go to Ridge Mill and make a left, follow the curve around, and on your left-hand side, there are a group of doctors' offices and buildings there. It's pretty easy to find. You'll see a nationwide insurance sign there. Make a left in there and follow it around to the back, and you will see our sign that says Embody Health and Wellness.
Absolutely. And it's a beautiful office as well. So definitely stop by. And you are also offering a deal today.
I am. So if you mention that you were that you saw this program, you will get a $69 massage. It's normally $85, so it's about 20% off or $16 off. And we'd love to make you a client and make you a believer in what we do. So please don't hesitate to get in touch with me either at info@embodywr.com or our phone number. You can give me a call anytime and ask me questions. Or you can Facebook message us at Embody Health and Wellness.
Absolutely. Fantastic. All right. And if you're interested in being a part of our CBD journey, we do have independent sales consultants. We have affiliates where they are having samples and completing orders that we fulfill. We love to have brand ambassadors, and you can also do direct sales like Sharon at Embody Health and Wellness, and be able to share a organic, lab tested, physician created products that you can trust. And so if you're interested in that, definitely reach out so that we can have a conversation so that you can reclaim your wellness in a more holistic and natural way.
Awesome.
So we do have an event coming up together, which I'm excited about. So our plan is that if you've heard about the terpenes and tannins that I've been doing in Cleveland that have been a great success, it is a wine tasting and CBD experience. We delve into the terpenes that you find in CBD. You learn about cannabis in general. You taste wines that complement certain terpenes, and you leave with a CBD 20 milligram roll-on that is infused with essential oils. And you'll learn how all of these things are similar, and that there's much more to CBD and wellness than just the product itself, but there's smells and terpenes that really enhance how well it can work for you. So our
what you're suggesting actually answers a question of mine, which is that you can have alcohol with CBD because there's no THC in it that's going to mix with it.
Absolutely.
So that's an important point.
Right. So when you have THC, you along with alcohol in general, that they actually enhance each other. So if you're not familiar with cannabis that well, you can end up having an experience that might not be as positive as you would like. And so they enhance each other and make the euphoric feeling of both more intense, keeping in mind that alcohol in general is a depressant, right? And so you're kind of creating a hodgepodge that you might not want to be a part of. With CBD, CBD does have the ability to enhance alcohol, but it doesn't cause that euphoric effect. So it doesn't make it an intense experience that might be sometimes a negative experience. So when we do the wine tastings, we do it with good judgment, but it allows you to see how those combinations can go together. And we do terpenes and tannins with wine and CBD. We also add in chocolate tasting at terpenes and tannins as well. And so our plan is to do a terpenes and tannin experience at Embody November 20th. And so go to our Facebook pages to learn more about that. Cleveland has loved it. Columbus, you're gonna love it. And so we look forward to bringing it down here, and we do it in a safe way. Everyone has masks. We have great conversations in good distance. And so it's a safe and great way to experience CBD and wine as well. So
And I can't wait to taste the chocolate.
yes, and the chocolates are amazing as well. All right, so unless we have questions, we're going to wrap up for tonight. I appreciate people that are watching it currently. Definitely look for those specials that we mentioned. And you can also see this video again on Green Harvest Health. We have a wellness toolkit series, and you can also find it on Embody Health and Wellness as well. And Sharon, it's great talking to you. You gave me so much good information that I think people need to know. Number one is that there's a difference between a spa and a therapeutic massage, and people need to know that. And that it can be something that's safe and something you can do during COVID. And CBD enhances that experience greatly. So
CBD enhances the science behind what we do.
yes, absolutely. Very good. Well, great. I appreciate it, and have a good evening.
Thank you for having me again. I really appreciate it.
Bye-bye.
Bye-bye.